This is Dr. Bailey. Today I wanted to talk to you a little bit about constipation and your baby. We will discuss some causes, symptoms, and treatments for your infant. First off, what is constipation? Constipation is a difficult passage of stool through the body that generally persists for longer than 1 week's time. This is very important since infants can vary in the number of bowel movements or dirty diapers that they have in a day or even in a week. It is normal for some breastfed babies to have bowel movements that may occur up to a week apart. It is also normal for your baby's bowel habits to change as they get older. You may initially notice that your baby has a bowel movement several times a day and that this can change to once a day or even go to once every other day or longer. This is normal and is not constipation. Signs to look for during constipation include your baby's stomach being firm to the touch. The baby may also seem uncomfortable and in more progressed cases may even refuse feedings and vomit after feedings. Simple techniques to aid with digestion include, but aren't limited to, massaging your baby's belly in a medium firm circular motion and placing your baby in a more than lukewarm bath. You may also bicycle your baby's legs to make sure that there is no retained gas. When feeding, make sure that your baby isn't over-anticipating the bottle. If your child vigorously opens their mouths to feed shortly before the bottle comes, then there is a good chance that they also have inhaled enough air to cause an air bubble in the stomach. If this is the case, then feed your baby and then stop shortly after you have begun feeding and burp your baby to clear out the air bubble. You want to make sure that the baby lets out a clear burp and that the air bubble is cleared for maximum comfort. We want that burp to be loud, more like a trucker's belch. Otherwise, you may find that your baby is routinely uncomfortable after feeds, may have poor feeding during feedings, and may act hungry after you've fed the baby a full meal. Should your infant still continue to have problems with digestion, you may also consider adding a probiotic drop to the feedings to aid in digestion. A different nipple that caters to your baby's feeding, so a smaller nipple or a larger nipple opening based on how quickly your baby feeds, and even possibly changing the baby formula. Please give your local pediatrician and/or our office a call to discuss different formula alternatives for your baby if this is the case, and let us know if you have any further questions. We look forward to seeing you and hearing from you. Take care.